You are what you eat. Managing your high blood pressure without medication. And this evening, I am excited to share with you a bit of information that is something that I love to talk about, which is high blood pressure. So my desire is that you can take away at least one bit of information that I'm going to share this evening and implement it in your life, whether you have high blood pressure or not, to improve your health. So who am I? If you've never met me before, I am Dr. Saren King. I am a physician, a mom. I am part caretaker to my mom who has dementia. I love to hike. I am a lover of simplicity and I love peace of mind. I am also an author, a content creator, and I have two boys who take a lot of energy from me, but they are wonderful and they are happy and they are thriving. So this evening, we're going to cover a few things. What is high blood pressure? What do the numbers really mean? What are your risk factors for developing high blood pressure? And how can you reduce that risk? Some complications that can be associated with uncontrolled high blood pressure, and how can you treat high blood pressure or manage it without the use of medication? And of course, there are some additional resources at the end. So this is a session and there was to be an icebreaker activity. And this evening's icebreaker is choose one positive word that begins with the first letter of your first name and also choose one word that describes your mood. So my name begins with an S. And so I'm going to choose the word superstar. And I'm feeling a little tired, but I'm okay. What what are your words? What's your one positive word that begins with the first letter of your first name? And what's one word that describes your mood? And our mood can change throughout the day from one day to the next, and that's quite okay. But it's always good to check in to see how we're feeling in the moment and if we're coping with what's happening. So this session is really an introduction to a 4-week course that will be coming up really soon. And you can learn more about that course towards the end. I'm going to go more into detail about that. So let's talk about what is high blood pressure. And to understand high blood pressure, we have to know what is blood pressure. And I like to use this little diagram to help explain what is blood pressure. So when we put the machine on our patients, we are measuring their blood pressure. But what exactly is blood pressure? So if this is the vessel that's in our body, that's transporting blood throughout all the parts of our body. If we were to take this vessel and cut it here and look through it like a pipe, this would be a magnified version of what our vessel would be. And so the pressure that we are measuring on the blood pressure machine is the pressure that is exerted on the walls or the inside walls of these vessels. And on the blood pressure machine, if you've ever checked your blood pressure, most persons have, you would notice two numbers. There's a top number or a big number, or the systolic pressure, which measures the pressure of when the blood is rushing out of the heart. And then there is a lower number or a smaller number when this is the diastolic pressure, when blood is rushing back into the heart and refilling the heart. And so there are two separate pressures that is being measured. And both of these pressures are important. Both the systolic and the diastolic pressures are important. And it tells us something slightly different depending on the reading. So let's look at some of the risk factors. And of course, this is not an exhausted list. There are many more risk factors, but these are just the 10 that I have chosen, not necessarily the top 10, but just the 10 that I have chosen. And at the top of the list, I've put genetics. Now, genetics play a big part in conditions that we may develop over time, that we can develop, and high blood pressure, one of those conditions that genetics may increase our risk of developing high blood pressure, but it does not mean that we will develop high blood pressure. It just means that we have to be mindful that there are other persons in our family, and so we are at increased risk for developing high blood pressure. Our age, as we get younger, as I like to call it, we are at increased risk for high blood pressure. And it's also said that men over the age of 60 are at increased risk than women over the age of 60. Our ethnicity as well, those of African American descent, Latin Americans and Asians, we are at increased risk according to the data. It does not mean that we will develop high blood pressure. Our weight, obesity and being overweight puts us at increased risk for almost every condition out there. So we really need to manage our waistline, manage our weight, not just to have a slim waistline, but because it will reduce our risk for developing conditions like high blood pressure. Our eating habits, the way we eat has a big impact on our blood pressure. And in this modern day society where everything is fast paced and instant, many of these ultra processed foods, these um, tin foods and fast foods, they are high in sodium, and too much sodium is bad for our blood pressure because it increases our risk of increasing our blood pressure. And so we should be limiting the amount of tin foods, fast foods, and ultra processed foods that we are consuming. Our level of physical activity also plays a major part. Persons who have a more sedentary lifestyle are at increased risk for high blood pressure. And also, those who work the graveyard shift, that midnight to 8 a.m. shift, they are also at increased risk for developing high blood pressure and diabetes because we were not meant to be up in the night, and it really wreaks havoc in our bodies when we are trying to stay up at a time where we were not naturally supposed to. Our environmental factors. So if we're in a highly stressful, toxic environment, either home environment or work environment, it puts us at increased risk. And one of the big things is stress management. We are not coping well with stress as a people, and it is causing our blood pressures to increase. It's causing us to have headaches, tension headaches, tension ulcers, stress ulcers, and migraines and other ailments out there. When we are not managing stress well, it can put a strain on our body, physically, mentally, and spiritually as well. Our lifestyle habits. So, consuming excessive alcohol, smoking, whether you're smoking lemongrass, marijuana, or chamomile or thyme tea, thyme leaves, it is a no-no. The smoke in our bodies increases our risk of developing high blood pressure, and certain medications can cause our blood pressure to go up as well, such as ibuprofen, some of the contraceptive medications, and sometimes other prescribed medications can cause our blood pressure to go up as well. So, what are some of the complications that can happen if our blood pressures are not under control? So, at the top of the list, I've put brain. And I'm going to use my little diagram again to explain the two types of strokes that can happen in the brain. So, we can have a bleeding stroke where there's so much pressure exerted on the walls of the vessel that it breaks and cause the blood to leak out into our brains and cause us to have a stroke. And also we can have a clot stroke. So there's a clot that may become stuck in the vessel, preventing the natural flow of blood in the body. And that can also cause a stroke in our brain. Our eyes can be negatively affected if our blood pressures are not properly controlled, causing us to have issues in our eyes and even lead to blindness. Our heart, again, we can have a heart attack or myocardial infarction happening in our hearts, where there's either a break in a vessel or there's a clot that's lodged in the vessel that can cause parts of our heart not to move, creating an issue and causing a heart attack. Then vessels. So anywhere blood flows, there are vessels. And vessels, all vessels can be affected by uncontrolled high blood pressure in any part of our bodies. Our kidneys as well can be negatively affected if our blood pressures are not properly controlled, leading to kidney failure, kidney damage, and we can also end up on hemodialysis, creating big problem in our quality of life. And our reproductive system as well. Half of men who have fertility issues or erection issues, it's because of a cardiovascular issue like high blood pressure. So we have to be aware of that. So what are some of the non-medication treatments? Now, it's important to note that even though you may be on medication or you may have been prescribed medication for high blood pressure, we still need to incorporate lifestyle changes in our bodies, which includes the foods that we eat. So as I mentioned earlier, these highly processed foods, tin foods, and fast foods, foods that are high in sodium or salt, which is used as a preservative to prolong the shelf life, should be limited or avoided as much as possible. Our lifestyle, the type of things that we engage in, our level of stress, we need to be mindful of how we are coping and adapting to the different stressors in our life, whether it's daily stressors, life-altering stressors, whether catastrophic stressors like natural disasters or environmental stressors that may affect the environment, the water, the air, or even noise pollution that can cause some sort of stressful event to happen in our lives. Our level of physical activity. We as a people, again, we have a more sedentary lifestyle. We are driving everywhere. We're taking some sort of transport to take us where we need to go. And we are not moving our bodies as much as we ought to, or as our ancestors did before. And this is causing us to be at increased risk for developing high blood pressure. And as mentioned before, stress management is critical in managing or reducing your risk and as a non-medication technique for dealing with high blood pressure. So do you need additional support? I've got you covered. I do have a workbook that has included more information and questions that you can answer. And this is on the PayHip store. So you can go to PayHip, a happy, healthy you.outlook.com, and you will find all of the resources, both low cost and free resources that you can get there. Also on the PayHip store is the high blood pressure overview, where you can get a bit of information that's easy to follow and remember. And if you need more support, I have a health and wellness support group on Facebook, Happy Healthy You, Body, Mind, Soul. It is a private community that you make a request and you can join, and I put information there from time to time. You can also go on the waiting list for the 4 weeks course that will be coming up very soon, and you can get even deeper with the learning how to manage your high blood pressure or blood pressure in general. And this course is meds without medication. It's a 4 weeks course, and it's managing your blood pressure naturally. And that will be hosted by me. And you can reach out to me, send in an email at info@ahappyhealthyu.site. And you can also find me on Facebook, A Happy Healthy You, for the private community, and also the Facebook page, A Happy Healthy You, Body, Mind, Soul, on Facebook, on Instagram, and also on YouTube.